Hi everyone. I'm going to be talking to y'all about my article chosen, which is the efficacy of continuous local cryotherapy following total hip arthroplasties. My sources or my article source was at the bottom. My citation. I found this one in 2019. So context and background. Basically, the purpose of this study was to determine whether or not cryotherapy is effective, specifically at relieving pain, reducing blood loss, as well as reducing swelling and improving patient satisfaction with having or after having THA surgery. So there were 60 people total in the study, 30 were treated and 30 were not. They all had the same type of surgery beginning to end. So opening and closing, everything was kind of the same. They tried to mimic everything the same way. There was one doctor doing everything. And so that kind of made it a little unbiased, I guess you could say. So methods, the 30 patients that were treated with a cooling device. They were put immediately after surgery. A cooling pad was put on them, and then they were hooked up to a cooling device called the Icing System 3000 for 72 hours. And so that was 72 hours straight as they were stagnant in bed. Usually after THA, they're in bed for a good amount of time, and so every time they were there, it was almost 72 hours straight, give or take a little bit. And then 30 other patients were not treated at all. So they were just they were treated after surgery, but just not with cryotherapy. So with this, it tested for blood samples, specifically creatine kinase and C-reactive protein, estimated blood loss during surgery, a VAS pain scale, which is what we use in the clinic, thigh swelling. They took the circumference during the whole process of the healing phase, and then the Womack index, which is a 0 to 1 scale, basically talking about pain, stiffness, function, things like that. And then other adverse outcomes were also tested, such as DVTs, wound complications, and infection that may have happened post surgery. Results. The results were interesting, actually. The thigh circumference was significantly lower in the cryotherapy group, but only on day 4, which was interesting because it's very specific. And then patient satisfaction was significantly higher in the cryotherapy group, but only on days 4 and 7. And so there really were no other significant outcomes between both groups. It was not statistically significant, sorry. And basically their conclusion was that continuous cryotherapy is effective immediately, but probably not long term, just because immediately after surgery it was effective, but the numbers were very small, and so it was kind of hard to tell that if it really was effective or if it was just happened to be that way, I guess, if that makes sense. Clinical applications, I feel like it is good for immediate injury. I mean, we do use it in the clinic. We use cryotherapy a lot, ice massages, game ready, things like that. But it's probably not as effective for chronic injury, just because usually swelling is there and then it's really hard to get rid of swelling and irritation and things like that sometimes. Psychologically, I feel like it's definitely there. Psychologically, it makes you feel better. It makes athletes feel better, and that's why they use ice, and that's why they ice after practice. And so I feel like cryotherapy is more prevalent when psychological aspects are taken into consideration. Critiques. I felt like it was difficult to fully blind this experiment because it's almost impossible to be like, oh, well, you have a machine and you don't. And so y'all are doing the same thing, if that makes sense. And so I thought that was interesting. And I think a better balance of genders was something that should have been more taken and counted into. Out of the 60 people, 58 of them were women and 2 of them were men. And I feel like men and women body types are very, very different. And so I feel like to fully do the study correctly, it would have been cool to see a better balance. I feel like it's also hard to determine a true pain scale for everybody because one thing could hurt for somebody and one thing could hurt from anybody else. And then difficult to get rid of adverse outcomes. It could sway completely just because some people experienced infection and some people didn't. And so that made things difficult as well. But that's all I have. So thanks.